at the end, 1 minute talking about the symptom assessment form. Then I'm going to pass out a link for all of you to do so you can help us validate that form. So this is the drug. This is rituximab vedotin. And what we have found in the last couple of years is that mast cells, abnormal mast cells, express on the surface a molecule called CD30. This drug is an antibody that, like a targeted missile, goes to CD30 on the surface of the mast cells. And when the drug is internalized by the mast cells, it releases a toxic payload to the mast cell, like a targeted missile. And the mast cells, we hope, will die. And so we're doing this trial on 11 patients. We hope to start again within the next several months. This is a drug that's already approved for lymphoma, or refractory relapsed lymphoma. So there is a known safety profile of the drug, and we'll see how it's tolerated in patients with mast cell disease. And this is the expression of CD30 on the surface of mast cells in the case of mast cell leukemia. This was published by Dr. Carl Sotler and Peter Valente and Dr. Horney in Pathology Journal of 2011. So this is an example of, again, mast cells having on the surface CD30 and using this drug as a targeted missile against mast cells with that protein. And then finally, let me get to the symptom assessment form. This was originally created, again, for patients with myelofibrosis disorders by Dr. Ruben Mesa. I'm doing this collaboration with Dr. Deepti Radia from Guy's Hospital in the United Kingdom. And the intent here is to, again, create a symptom assessment form that's user-friendly for mast cell patients, and we need to validate it so it can be used in the future. And this is not easy to see, but basically, it's going to be a link that you go online and you fill out the question: gender, what disease do you have? When were you diagnosed? What medications do you take? Have you had any treatment for skin lesions? And then it goes and asks you to rank your symptoms on a scale of 0 to 10. Okay. Weight loss over the last 6 months, overall quality of life. Describe one number below about how the symptoms have affected you: flushing, feeling anxious, feeling faint or about to pass out without actually losing consciousness. How much do the skin lesions bother you? Do you have skin lesions? Do they bother you only for cosmetic reasons? Have you ever had any anaphylactic episodes? And then if you say yes, then we ask you over the last 6 months, over the last 12 months. Have you ever used an EpiPen? And we're going to sort of ask you all that too. And we're going to ask you at the end whether there's any questions that we didn't include so we can modify the form to better represent what things you're thinking about. And this is just an example of how this form has been used in patients with myelofibrosis. And these are patients who filled out the form, and we can get a very good idea about what % of patients are experiencing what symptoms. And again, it would be very useful to use this pre-treatment on a trial and during treatment on a trial. So we're very excited about your feedback about the form. And since I'm only about 3 days overdue with my talk here in terms of length, I'm going to stop there and thank my colleagues and thanks for your attention.